Thanks for being back and with us, and all of you who are there with us. As I was discussing about diabetes, now I am continuing the discussion in diabetes in English, and all those who are just to join us in English, for them it will be a starting in diabetes. Diabetes is known as Madhumeh in Ayurveda. It is a disease which, irrespective of the countries, of the boundaries, has no boundaries. It is a disease which is prevalent in all the major countries in this globe. The developed the country, the more the number of diabetic patients in that country. So it is a disease which in itself is an underlying cause of so many other diseases. And that is why knowing what exactly is diabetes, how it occurs in a patient, and then how a person can come out of diabetes is very important over here. So let us start with what exactly is diabetes. In our body there is an organ known as pancreas, which has various functions in the body. Some of the functions of pancreas are related to digestion. There are various other functions of pancreas which are apart from digestion, and they are the endocrine functions of pancreas. We'll be talking about the beta cells of pancreas. It's the beta cells of pancreas which secrete insulin. Now, what exactly is insulin? Insulin is a hormone which is required for the entry of glucose inside the cells. Glucose is the basic product of major source of energy. All kind of complex carbohydrates that we are taking, they are gradually changed into glucose, and then that glucose goes inside the cell to provide energy. But for the glucose to be able to enter the cells, insulin is the key. Insulin, if available, if present in the sufficient required quantity, it's only then that the glucose shall be able to enter the cells. And this insulin is produced by the beta cells of pancreas. So depending upon the reason for being diabetic, a person may be diabetic since birth, which is known as childhood diabetes or juvenile diabetes. A person may become diabetic in the middle ages, like the one suffering from MODY, maturity onset diabetes mellitus of the young. Some may become diabetic in the later stages of life. So the reasons may be different, the age may be different, but the end result is almost the same. Due to the less amount of insulin that is available, the body is not able to utilize the glucose. The glucose which was meant to provide energy to the cells now becomes higher in the bloodstream. And that is when, if a patient goes for a fasting blood sugar check, the person sees that the blood sugar level is now above 120. If the fasting blood sugar is persistently above 120, the person is then categorized as being diabetic. And as the person becomes diabetic, in allopathy, the only thing that a person is then told is don't take things which contain sugar in them. If the person is suffering from type 2 diabetes, then the person is given oral anti-hypoglycemic drugs like glimepiride, metformin, glibenclamide. There are so many of them. They are given to the patient. Those stimulate the pancreas. The pancreas are stimulated by them, and the beta cells, despite the fact that the beta cells are not that well, they are stimulated enough so that those beta cells now produce more of insulin, and now the glucose can enter the cells. It does control the blood sugar up to some extent, but then in no ways this is a cure for diabetes. So if a person is diabetic person, the biggest thing that the person needs to realize is that diabetes is a lifestyle disorder. Why, as per Ayurveda, person got diabetic? In Ayurveda, it is said, Asya sukham swapnam sukham, dadini gramya odak anuprasam payansi, navanna panam cha gudvarakitam pramehitusya kafkricha sarvam. That means that if a person is diabetic, as far as Ayurveda is concerned, for the person to be diabetic, the lifestyle of a person is the most important. If a person is having faulty lifestyle, a lifestyle which is over relaxed, in which the person is taking more of sugar rich things and is not doing exercising, is leading a sedentary lifestyle, that patient is at high risk of being diabetic. And then diabetes is a type of prameh. So madhumeh is a type of prameh. And when a person becomes diabetic, in allopathy there are two choices for the person. If the person is having some beta cells, then oral anti-hypoglycemic drugs are given to the patient. It stimulates the beta cells. The beta cells secrete more of insulin, and the blood sugar levels may be managed for some years. And if the person is on insulin dependence, then direct insulin injections are started in that patient, due to which the person may have hypoglycemic episodes also if the insulin is given on a overdosage. The thing which is important over here to realize is that both these things given to a patient in no way prevent the development of diabetic neuropathy, diabetic nephropathy, or any kind of diabetic retinopathy in the patient. And the worst part of being diabetic is that despite all kind of controls, that is what allopathic doctors guide, despite those controls of taking less of sugar and taking all kind of allopathic drugs, when a person is diabetic for more than 15-20 years, diabetic neuropathy, diabetic nephropathy, diabetic retinopathy, these are very common to occur in diabetic patients. What is diabetic neuropathy? Now, diabetic neuropathy is a disease in which, due to being diabetic, slowly and gradually the nerve cells, they start getting damaged. And that is the reason that diabetic patients generally complain that I am having burning feet, my tongue is burning. Various kind of nerve sensation related problems are faced by diabetic patients. So that is diabetic neuropathy. Unluckily, since in allopathy there is no cure for any kind of nerve damage, that is the reason why that if a patient is suffering from diabetes, the patient is not able to get out of this neuropathy. Coming to nephropathy, our kidneys are blessed with nephrons which work day and night to excrete out various kind of toxins out of the body. Now once the kidneys are not working to that an extent in a diabetic patient, due to diabetes, the disease is diabetic nephropathy. What happens in it is that slowly and gradually the nephrons, since they are not being provided with the requisite amount of energy in a proper way, the nephrons, they keep on getting damaged. And once the nephrons are damaged beyond a certain extent, the patient starts having a higher creatinine and a higher blood urea level. What I always advise my patients over here is that if you are diabetic, do keep in mind to get a 24-hour urinary protein excretion test done on a regular basis. Because if you are diabetic and you don't get this test done and you are relying on serum creatinine level, blood urea level, once those levels go beyond a particular extent, it means that the kidney is not working to already more than 50, 60, 70%. So if you are diabetic, keep a thorough check on the 24-hour urinary protein excretion. Shilpa Arora ji, as far as diabetic neuropathy is concerned, yes, definitely there are medicines in Ayurveda which can reverse diabetic neuropathy. Karanj, Pongamia pinnata being one of them. If we talk about a single herb, and if we talk about combinations, then the metallic combinations are Ekangvi Ras, Mahavat Vidvans Ras, Brihatva Chintamani Ras. And if we talk about the herbal combination, Shilajit is one of them. And if we talk about patented combinations which we provide, one of them is Toxicare. Toxicare is a medicine which controls Vayu and is very good for a patient who is suffering from diabetic neuropathy. And along with that, there are certain oils mentioned in Ayurveda like Dhanvantram Telam, which is very good to be massaged for providing relief. And if the person is suffering from extreme kind of diabetic neuropathy, then we are having indoor treatments for such patients at our Panchkarma centers. A patient can definitely come out of this disease with the help of that. Yes, Harinderji.
Sir, Raghav Pradhani, I have a question. How can exercise can make difference in diabetes?
See, exercise is something which is very requisite in a patient suffering from diabetes. Because if a person is suffering from diabetes, which is a disease related to lifestyle disorder, if we start doing pranayams in a regular way, by pranayams, the first and foremost best pranayam for diabetes is Kapalbhati. So if we are doing Kapalbhati in a diabetic patient, that is one of the best exercising. And if we are talking about exercising, there were also ones that everyone asked Lord Brahma, Brahmaji, if someone is suffering from diabetes, what should that person be doing? To this Brahmaji replied, that person should take a visit to 100 homes daily and start begging over there. This was a very strange kind of reply which was given by Brahmaji. Then Narad Muniji asked that what is the meaning of this? And Brahmaji very deeply explained it to him that if a person is diabetic and he starts going to 100 homes, that means he is covering 100 yojan distance on foot. At that time, the homes used to be 1 yojan apart. So that means that walking is very good for a diabetic person. And when a person is begging, that means he has gave away all the worldly things and all. He is in a meditative state. He is in a stress-free state. That means that if we want to control diabetes, being stress-free is very important. So in a diabetic person, walking and being stress-free through meditation is something which plays a very important role. So if you are diabetic, definitely exercises plays a very good role in that. So coming back to what I was discussing about diabetic neuropathy, nephropathy, let's now come to diabetic retinopathy. Diabetic retinopathy is a disease in which the retina slowly and gradually, see, retina is the most important part of our eye. When we are visualizing anything, it is the retina which is the most important part through which our brain gets a message and then we know what exactly we are watching. So if a person is suffering from diabetic retinopathy, in allopathy, it is incurable. And there are so many patients of diabetic retinopathy which regularly approach us because in allopathy there is virtually nothing that can be done in diabetic retinopathy. For those of you who are suffering from diabetic retinopathy, there are two kinds of treatments, but the best one which I advise in those patients is the indoor treatment which we do. There is a thing known in Ayurveda which is known as Akshitarpanam. We have developed a special kind of curriculum combined with Akshitarpanam, Nasya Kriya, Shirobasti. All these combined, when done in a proper way in cases of diabetic retinopathy, the results are miraculous. So if any one of you is suffering from diabetic retinopathy, again Ayurveda is the pathy of choice. So what I was telling you was that our focus when we are dealing with a patient suffering from diabetes is not just controlling the blood sugar level.
So we got a message from Rajiv Bansal. So my father is suffering from the diabetes since 15 years, having insulin injection twice a day. Kindly assist.
See, since he is now suffering from diabetes since last 15 years, if we all at once commit that the injections can be immediately stopped, it will be wrong. But once we start our medications in his case, slowly and gradually, the dosage of insulin injections that is required will come down. Say for example, if he is taking 20 units of insulin in the morning, 20 units of insulin in the evening, slowly and gradually the quantity of insulin units will be decreased from 20 to 18, from 18 to 16. Like this, we will slowly and gradually taper down the insulin requirement, and will definitely try to bring him away from insulin so that he can lead a better life. Another thing which is very important to note over here is that, as it has been mentioned, that he is suffering from diabetes now since past 15 years. As I was just talking about, it's very important to prevent diabetic neuropathy, diabetic nephropathy and diabetic retinopathy in his case. Generally, we people, even the educated lot, we go as per the doctor's advice, which is otherwise correct also. Because when doctors are advising us that, see, you are to take care of your blood sugar level and that's it, we generally follow our doctor, which is not wrong. But then what the doctors not advise us over there is that despite the best of blood sugar level controls, after a particular time, the diabetic neuropathy, diabetic nephropathy, retinopathy, myopathy and other associated problems of diabetes cannot be prevented with the allopathic treatment. That is where lies the importance of Ayurveda. If we are taking Ayurvedic treatment under a proper doctor, when I am talking about Ayurveda, I am talking about sealed Ayurveda. There are people who run after miracles in Ayurveda. They go for loose kind of Ayurvedic medicines against, and for those I am always against. I never advise anyone to go for loose Ayurveda. So if you are going for proper sealed Ayurveda, that Ayurveda is really very helpful in a diabetic patient. So let's now come from one herb to the other in Ayurveda. If I talk about the first herb in Ayurveda which is very helpful in diabetes, it is Gymnema sylvestra. It is known as Gurmar Booty. Gymnema sylvestra is a herb which is available around the globe, and it is one of the most sorted out herb for diabetes. This Gymnema sylvestra has also shown properties of repairing the beta cells of pancreas, and it also helps in blood sugar level control. So Gymnema sylvestra should always be preferred. The second important herb over there is Karela, Momodica. Momodica is a common vegetable which is used everywhere, but what I generally advise my patients is that the most important part of that is the part which we peel off while cooking it. So do make sure that next time when you peel it off, try putting that peeled off thing while cooking, because that is the one which contains plant insulin in it, phytoinsulin. Phytoinsulin is an insulin. If it goes inside the body, it decreases the workload of pancreas, because somewhere the pancreas, despite being not so well, has to overwork in a diabetic patient. Even in Ayurveda, if we are only piling up a patient with pancreatic stimulants like neem, it won't give a permanent kind of a recovery. It will give blood sugar control without harm. The next thing which is very good in diabetes is Vijay. Vijay is a herb. There are glasses available of Vijay in the market. People generally soak water in it overnight and drink the water. Vijay is known as Asan in Sanskrit. Asan is the common name for Vijay in Sanskrit, and this Asan is really very helpful in a diabetic patient. So that also can be taken by a diabetic patient. If I talk about another herb which is very good in diabetes, that is Jamun, Cesium cumini. Now that again is very good. Jamun ki gutli, basically when you are talking about jamun, the fruit pulp is not that important, it is more sweet, but the gutli of jamun is the most important one. We can take the powder of it. It is very helpful in a diabetic patient, because if we are taking it, it again contains beta cell repairing factors. At the same time, it is a bit stimulant for a patient suffering from diabetes. So due to its stimulant action, it stimulates the beta cells so that they can excrete out more of insulin, which is very good for a diabetic patient. Now if we talk about the combination we can always combine all of these in a powdered form and take them. The preferable time for taking these is half an hour before the meal. In Ayurveda, we say it as Prag Bhakt, the medicine which is taken before meals. So, any kind of anti-diabetic medicine, if it is taken in Prag Bhakt Kal, it is a better option. If I talk about the combinations now, these were some single herbs which I just talked about. There are various combinations. One combination of choice in diabetes is Vasant Kusumaka Ras. It is a combination which is one of the drug of choice for diabetic patients. You can take it along with Vasant Kusumaka Ras. If I talk about another combinations, there are Nimbadi Churn. Nimbadi Churn is a churn which is good for skin as well as diabetes. So if you are suffering from diabetes, you can take Nimbadi Churn also. Again, if I talk about our combinations, there are two combinations that we have developed. One of them is ND-Diabcare. ND-Diabcare is a combination which contains most of the herbs which I just talked about, and it also contains Vasant Kusumaka Ras in it. So ND-Diabcare can be taken without any risk by any of our diabetic patients. Along with that, another combination which is herbal one is Diamynil. So you can take both of these, Diamynil and ND-Diabcare, or you can take one of these two. The thing which you have to remember is, if you are on insulin, you can download our mobile app, stay connected to our doctors, so that you have to gradually plan it out how to reduce on that insulin. Gradually, don't immediately omit that insulin. So all of you who have been there with us over here today in this live session, diabetes is a disorder which anyone nearby you must also be suffering. So do help anyone suffering from diabetes. It's not just about our medicines. Be it anyone or anywhere from Ayurveda that they are starting the treatment, they should start changing their lifestyles too. Because lifestyle is something which they need to work on. Lifestyle management, a bit of diet management, and a bit of good Ayurvedic treatment can bring you out of diabetes. Another thing which I always advise in all my sessions is meditation. Meditation is something which is of utmost importance in all kind of diseases. Especially if you are suffering from diabetes, meditation is something which will really help you out. When you are meditating, close your eyes, take a deep breath inside, leave the breath, and while you are leaving the breath, feel that your body is being detoxified. Do it regularly. If you want any assistance in meditation from us, we are there to help. We shall always be guiding you. You can contact, you can leave a message in this YouTube lives of mine, and our meditation department will be connecting to you so that you can meditate in a proper way. Our 24/7 helpline numbers are always available for your assistance. So whenever you want the right kind of Ayurveda, there are various options to reach us out. You can reach us out through our mobile apps. You can reach us out through our 24/7 helplines. You can email to us. If you are sitting over there in the US, there is Vaid Rajiv Sethi, Vaid Sulakshana Sethi over there representing us over there. You can stay in connection to them. You can connect to us through them. If you want Panchkarma therapies to be done over there and you are there in the US, we are having Femina Ayurvedic Spa where Jyoti ji is over there to help you out. You can always discuss with us how and which therapies you need to take, and you can get the therapies done from there. And if you are visiting India, or if you are from India, you are always welcome on our Panchkarma centers where we always advise and give the best of Panchkarma treatments so that the patient as well as those who are non-diseased stay healthy. So stay tuned. Don't forget to subscribe the channel and do enable the notification so that when we are live the next week for a new session, we all join together to discuss something new, something the Ayurvedic way, something which is really helpful for everyone, for the masses. So thank you all for joining us. Stay connected. Bye bye.